Tonight from the 8 on Your Side team, a look at oral cancer. It's no longer just a disease of older men who smoke or use tobacco. Many young people are now getting it.
Well, the FDA recently approved a device that helps dentists detect the disease early when the survival rate is high. Medical reporter Susan Shapiro checks it out.
So we look at all the soft tissue first clinically.
Bob Vitale is in the dental chair to undergo a new and simple screening for a serious and often deadly disease, oral cancer.
A lot of oral cancers can begin at the bottom or the lateral sides of the tongue.
You hope there's nothing, but if there is, the sooner the better, I guess, to know.
The Oral Cancer Foundation says more than 35,000 Americans, including many young people, will develop oral cancer this year. 7,500 will die of it. In the past, patients who developed oral cancer were usually older male smokers and tobacco users, along with heavy drinkers. Now, many young men and women, including non-smokers, are being diagnosed. The cause? Human papillomavirus, or HPV. It's most often transmitted by sexual contact.
It's very frightening.
Lancaster dentist Matthew Friedman says the problem is that oral cancer is often detected in its late stages.
By the time you see something clinically in the mouth, the survival rate is very low. The 5-year survival rate is 30% because it starts under the tissue and you don't see it for a while.
And he says the surgical treatment for advanced disease can be devastating.
I'm going to have the Velscope up close to your mouth.
In addition to the regular clinical exam, Dr. Friedman now uses a new portable device for screening.
And it'll sound like a hairdryer and you'll feel a little bit of heat.
While Bob Vitale is wearing special amber glasses, Dr. Friedman turns on the Velscope. The blue light stimulates natural fluorescence in the soft tissues of Vitale's mouth, allowing Dr. Friedman to see any abnormal tissue that wouldn't yet be visible with the naked eye.
Go ah.
Abnormal tissue shows up a different color than normal tissue through the lens.
That's it. Everything looks great.
Vitale gets a clean bill of health.
Do you have any questions?
He says the test was no problem.
It's non-invasive. It's fine. I mean, you just have to keep your mouth open and try not to talk. It's fine.
Vitale will now wait to see if his insurance company will cover the screening.
Turn toward me.
Susan Shapiro, On Your Side, News 8.
If abnormal tissue is spotted, the patient is advised to have a follow-up in about 4 weeks. If it's still there, a biopsy may be recommended. Other things, like inflammation, can show up as abnormal tissue and are usually gone in that time.